Thank you, whoever reminded me to record, probably Jess. We are happy to welcome Ben Teinsvold as our speaker today. Ben is the Executive Director of the Community Health Worker Collaborative of South Dakota. And he has been the lead contact for the CHW SD since its inception in January of 2020. And he's led us through significant growth over the first 3 years, in part due to the CDC Health Disparities Grant funding from the South Dakota Department of Health that they received in June of 2021. For those of you that know Ben, you know he's passionate about the CHW profession, and he really works to be that strong ally for all CHWs. Ben previously worked with the South Dakota Department of Health way back in 2015 and 2016 on community health worker related introductory projects. This work led to key recommendations for CHWs, which then the South Dakota Department of Social Services used to develop the CHW Medicaid reimbursement. Ben has a Bachelor of Arts degree in Communication Studies and in Public Relations from Southwest Minnesota State University, and he recently completed a graduate certificate in Public Health from New Mexico State University. So congratulations, Ben, on that. Before we get started, I did want to remind you that there is a session next week as well with Dr. Christine Arnold from Sanford Health Mitchell Clinic. And she'll be really focusing on integrating CHWs into a clinical or medical practice. And so I will put the registration link in chat if you have not registered for that already. We would encourage you to do that. So with that, I want to go ahead and turn it over to Ben. He will be sharing his slides and get started here. Thanks, Ben.
Awesome. Thanks, and happy afternoon to everyone. I think we've made it to the afternoon mark even for our West River friends. So excited to share a little bit more about how we are working across South Dakota to sustain the CHW workforce through Medicaid and Medicare reimbursement. So just a quick share and level set what titles we use here in South Dakota. We do have 2 titles. The first is a certified community health worker, and the second is a community health representative, or CHR. CHRs have been established across our 9 tribal nations in South Dakota for over 55 years now. So we continue to recognize and utilize the community health representative title across South Dakota, as well as utilize the community health worker and certified community health worker title here in South Dakota. Just to recap quickly on what certification looks like here in South Dakota, it does require completion of an approved training program. Currently, we have 2 training programs directly here in South Dakota, one through Lake Area Technical College and one through Southeast Technical College. Both are available completely online, other than the 40 hours of shadowing that's done in person in the community where the students are completing their training program at and where they're planning to work as a community health worker. Certification does also require a supervisor reference as well as a background check, not only an employee background check, but also a fingerprint background check. Certification does require completion of 12 continuing ed credits every 2 years, and there is a $50 initial fee for certification as well as a $50 recertification fee. We do have sponsorship and scholarship opportunities available should that $50 fee be a challenge for someone to come up with those funds to be able to be certified. And certification is voluntary unless an individual is working for a CHW or CHR agency that is seeking Medicaid and or Medicare reimbursement for services. So we do have voluntary certification here in South Dakota, with it being required if an individual is working for an agency that is seeking reimbursement. We currently have 104 certified community health workers and community health representatives across South Dakota, and we're continuing to see more and more certify across South Dakota. So just to share quickly where we're at with our workforce here across South Dakota. As you know, back in January of 2020, when the Community Health Worker Collaborative of South Dakota started, as Vicki mentioned in my introduction, we did not have any community health workers. We did have about 85 community health representatives across our 9 tribal nations in South Dakota, but we did not have any community health workers. So fast forward just 4 years later, we now have and continue to support our 85 tribal CHRs across South Dakota, but we also have 140 community health workers across South Dakota, bringing our total workforce to just over 225 individuals. We have 10 individuals currently in a training program and 10 individuals planning to begin training just next month. So this map shows counties where CHWs and CHRs are directly employed, as well as additional counties served by CHWs and CHRs. Here in South Dakota, we cover a very rural landscape, and so we're not afraid to get in our cars and drive a few 10, 15, 20 miles to work with patients and clients across South Dakota. So therefore, we have CHWs working in multiple counties. And then the stars represent the tribal CHR program offices across South Dakota. Our CHR programs do cover their entire reservations that they serve. So they definitely, as CHRs, are putting on many, many miles to work with patients and clients across the areas that they serve. So here in South Dakota, we are really fortunate in that our scope of work really dates back to the work in 2016 that was co-led by Department of Health and Department of Social Services. And that work really developed key recommendations for community health workers, especially when it comes to the scope of work. So this scope of work in South Dakota is supported by both Department of Health, who is promoting and developing the workforce, as well as Department of Social Services, who reimburses through South Dakota Medicaid for CHW services. So the scope of work is health system navigation and resource coordination, health promotion and coaching, and then health education, specifically to teach or promote methods and measures that have been proven effective in avoiding illness and or lessening its effects. So we're really fortunate again to have that scope of work really supported by both Department of Health and Department of Social Services here in South Dakota. South Dakota, speaking of Medicaid reimbursement, was the third state to have a fee-for-service reimbursement for CHW services. That started April 1st of 2019. We're now one of 15 states to have a fee-for-service reimbursement through a state Medicaid program. And there's probably 10 or so states that are currently working on navigating through the process to begin a Medicaid reimbursement opportunity for CHW services. So just a quick recap what Medicaid reimbursement services look like here in South Dakota. An individual needs to have a qualifying condition and or a qualifying barrier. So we see qualifying conditions. This is just a short list, not an exclusive list of qualifying conditions, but some of the more common qualifying conditions that we're seeing across South Dakota. And then we also have the qualifying barriers, especially focusing in on the social determinants of health barriers, really anything that's related to your health that's not directly your health. So housing, food, transportation, childcare, things that really impact your health but are not directly your health. So again, it's an and or situation. It's a qualifying condition and or qualifying barrier. We do have some specifics that South Dakota Medicaid details when it comes to Medicaid reimbursement for CHW services. Those details are that it's no more than 4 units or 2 hours of service per day per Medicaid recipient. So a community health worker could have, 2 hours of billable services with one patient, followed by 2 hours of billable services with another patient, all in the same day. But for each individual patient, services can't exceed the 2-hour mark as far as reimbursement goes per day. Additionally, patients or Medicaid recipients, I should say, cannot receive more than 104 units or 52 hours of service per year. The Medicaid service year is July 1 through May 30th each year. And community health workers really truly go out into the community, into the homes. They really connect with those that they're serving. And South Dakota Medicaid really recognized this early on. And so there is a cap on the number of units that can take place in a clinic setting. So up to 5 units or 2.5 hours can take place in a clinic setting before services need to transition to the home, the community, telehealth, or telephone encounters if telehealth is not available and there's a documented barrier. So really focusing in on that community aspect of leaving the walls of the clinic if it is a clinic-based program and really transitioning out into the community, into the home, and providing services and meeting individuals where they're at. Services from Medicaid that are reimbursed do require a provider referral and service plan. Providers who can refer are doctors, physician's assistants, nurse practitioners, certified nurse midwives, or dentists. It does not need to be the Medicaid recipient's primary care provider. It can be any provider that meets that criteria of being a specified provider type as listed here. And then services in South Dakota can be billed at an individual or group rate. Group rates can be used for evidence-based training programs that are offered in a group setting, as well as group rates are typically used for families here in South Dakota. So if a mom has 2 children and the 2 children are Medicaid recipients and the CHW is working with mom to navigate food security and housing security, that really focuses in on services provided on behalf of the children as Medicaid recipients. It's obviously not a 2-year-old who's grocery shopping or going to the food pantry or a 4-year-old who's signing an apartment lease. And so it's really focusing in on providing services to the mom on behalf of those 2 Medicaid recipients. And so that service would be billed at that group rate. Overall, here in South Dakota, of the 15 states that have CHW reimbursement through a state Medicaid program, South Dakota has the highest reimbursement rate. For an individual, it equates to $64.86 per hour. So reimbursement here in South Dakota really is, as I said, the highest in the country, but also really helps to not only offset the cost of the individual hour of service provided, but also mileage reimbursement, time spent traveling to and from appointments, as well as the time spent documenting and billing for that service as well. So we have much more information on our website about reimbursement. It's really broken down into 3 separate sections, focusing on Medicaid enrollment, implementation, and then billing for Medicaid here in South Dakota when it comes to community health worker and community health representative services. So just to recap the importance of reimbursement and how it's really helping to sustain CHW programs across South Dakota, this is data from South Dakota Medicaid. We have great partners at South Dakota Medicaid who openly share this data, not only with us, but with anyone who asks for it. And this is a huge success here in South Dakota with over 8,900 claim units have been processed through claims since July 1st of 2023. The start of this state fiscal year's Medicaid year. So those units equate to over $235,000 that have been reimbursed to local community health worker agencies who are employing CHWs across South Dakota. We currently actually now have 15 agencies that have billed so far. This data is only through April 18th. So between April 18th and today, we've had 1 additional agency successfully submit their first claim. We have 13 additional agencies that are approved for billing Medicaid. They just haven't yet submitted their first claim. And then we're continuing to work with 10 additional organizations to finalize the enrollment process for Medicaid reimbursement. So our first claim did not actually go through until March 16th of 2023. So it's just been just over a year since our first Medicaid claims began processing here in South Dakota. So each week we continue to see more and more claims submitted. And as noted here, from just April 18th through now, we continue to see more and more CHW agencies starting to submit their first claims. Overall, we had a goal of really getting 6 organization types up and billing with Medicaid. And so we have medical clinical sites billing, we have an FQHC or federally qualified healthcare center billing, we have community-based organizations billing, we have cross-trained EMS CHW programs billing, where we have EMTs who have cross-trained as community health workers. We have a dental program that successfully started billing Medicaid for CHW services. From what we've heard, it's the first dental program in the country that employs CHWs to have successfully billed a CHW claim. And then most recently, our latest success, I should say, was having our first community health representative or CHR program successfully bill Medicaid. The Oglala Sioux tribe, their Rapid City CHR program was not only the first CHR program in South Dakota to bill a state Medicaid program, or to bill South Dakota Medicaid, I should say, but also the first CHR program in the country to bill a state Medicaid program. So we're really continuing to see that once organizations submit their first claim, they get through all of those hurdles and barriers or perceived barriers to billing, they're really having huge success in the reimbursement that they're receiving to help offset their wages. So just wanted to recap and put into perspective what all of that process looks like when it comes to not only billing Medicaid for services, but also the reimbursement that organizations are receiving. So next we'll jump quickly into Medicare reimbursement. This became available just January 1 of 2024. So not much is known about Medicare reimbursement. We continue to learn new things every day, but just wanted to highlight here a pretty similar scope of work. It does require individuals to have an eligible condition, so an unmanaged social determinants of health need, or a chronic disease management or long-term illness management need. The biggest barrier we see not only here in South Dakota, but across the country is that the Medicare reimbursement does require a primary care provider during an evaluation and management visit with the primary care provider to address the chronic disease and long-term illness and refer to a community health worker, or identify a social determinants of health need through a screening and then refer to a CHW. The reimbursement is a little bit higher for Medicare, and we do see the use of ICD-10 diagnosis codes as well as G codes instead of CPT codes. So as I said, it just went live January 1 of 2024. We're still continuing to learn more and more about Medicare reimbursement as it impacts our CHW workforce here in South Dakota. We did have our first organization submit and successfully submit Medicare claims just a few weeks ago, and they continue to submit claims, and other medical clinical organizations are starting to look into submitting Medicare claims as well. Overall, we're really working with national partners like the National Association of Community Health Workers to really help Medicare understand that the limitations regarding the primary care provider requirement are really hindering the availability for organizations outside of medical clinical organizations to bill for CHW services, because it does require that primary care provider referral and that the CHW work directly in the same organization or contract with the primary care provider's organization. So enough about the details of what Medicaid and Medicare reimbursement looks like. I want to show just a little bit more as we wrap up today how reimbursement can really support positions and sustainability. So when we look at the $64.86 for 1 hour of reimbursement, when we divide this over 8 hours, just 1 hour of reimbursement per day is already offsetting $8.11 per hour of a CHW salary. If we bump that up to 2 hours, we're offsetting about just over $16 per hour of that 8 hour a day salary. And then if we look at 3 hours of reimbursement per day, that's where we're really looking at 3 being that magic number of if an organization can bill 3 out of the 8 hours a day that a CHW works, they can really offset the entire salary of that CHW throughout the year. So putting that into further perspective here, if we look at, again, the hourly reimbursement of $64.86 per hour, and if we look at a CHW having an hourly wage of $25 per hour, that includes benefits. So for example, it might be $19 an hour. That is the hourly wage, but then with benefits, we get that $25 per hour. We then look at 47 out of 52 weeks out of the year that the CHW is working. We have holidays, vacation time, sick time, professional development time. So we know, CHWs nor really anyone is working all 52 out of 52 weeks of the year. We have vacation time, holidays, etc. So in this scenario, we also added in $2,500 in mileage to cover CHW mileage traveling to and from homes and appointments, as well as a $600 cell phone stipend to offset a cell phone for that community health worker. So if we look at just 2 hours of reimbursement per day, 47 out of the 52 weeks out of the year. Just that reimbursement is offsetting 55% of the total CHW's salary, benefits, and program costs. That leaves about 45% remaining, or about $21,000 that the organization would need to come up with from other sources, either from building that CHW salary into a future budget or looking at other cost savings. For example, if it's a medical or clinical program, there might be significant cost savings because the CHW is also actively working to enroll individuals in Medicaid who previously did not have a payer source. And so a health care organization or system might have been writing off, tens of thousands of dollars in care, and the CHW has now secured a payer source for that individual. There's also looking at opportunities for improved patient outcomes and what that means to the organization. There's looking at improved staff supports. If staff are able to work with community health workers and work at the top of their license, if they're a nurse or a social worker, that allows the CHW to then work under their scope of work and free up some of the time and the duties that the nurse or social worker might have been doing in the past before the CHW program started. So that's looking at just 2 out of 8 hours a day over 47 weeks out of the 52 weeks in a year. If we jump and bump it up to 3 hours, that's where 3 is really that magic number. At this point, 83% of the CHW position and expenses are covered just by those 3 reimbursable hours a day, leaving just 17%, or approximately $9,000. So really, to try and justify $9,000 in a budget for a full-time position, that really isn't much. You could really start to look at, if you're a medical clinical program, if your CHW helps 1 or 2 individuals sign up for Medicaid who you previously were writing off services, $9,000 in written off services, that could be how much just one patient's 2-night hospital stay might have cost your organization. So really looking at it from that perspective and the benefits that you're receiving from having the community health worker as a full-time position within your organization, that alone can often justify the $9,000 that isn't covered by Medicaid reimbursement. We can also look at, are there increased satisfaction among employees? If you're a medical or a hospital setting, is there, improvements in emergency room care? Is it, individuals are working with your CHW to decrease or eliminate unnecessary ED utilization and use so that others who do have emergencies can be seen sooner? There's lots of different ways to look at that $9,000 difference here. And then really the sky's the limit depending on the population served by a CHW program. If an organization works with a high Medicaid population, they could easily have 4 of 8 hours in a day be covered by reimbursable services. And that could really cover 100% of the CHW's position, salary, and expenses. So that's just the tip of the iceberg when it comes to all of the opportunities to understand reimbursement and cost savings and program sustainability. We have our 3rd annual South Dakota CHW conference on May 21st and 22nd in Sioux Falls. And so we will have not only 3 keynote speakers, but also 16 breakout sessions. One of our breakout sessions will actually be further focused on sustainability and return on investment. And we'll have Ashley Lowing from the South Dakota Department of Social Services taking a deep dive into what do the cost savings look like for Medicaid, as well as how do those cost savings translate over to organizations who employ CHWs. So great opportunities at the conference in Sioux Falls on May 21st and 22nd. So with that, I see there's a couple questions in the chat, but other than that, thank you for the opportunity to present. It's always exciting to see that timeline from talking about CHWs in 2015 to fast forward 9 years later, and we're talking about how programs are being able to sustain their workforce because of the Medicaid reimbursement. And now with the Medicare reimbursement just starting to roll out, it's continuing to look more and more promising that our community health workers will have that sustainable reimbursement for many years and decades to come. So our workforce will be able to continue to grow and develop for many years to come. So with that, any questions anyone has today?
Ben, I'll just On behalf of everybody in attendance, I want to thank you for sharing your knowledge with us today. There's just a couple questions. If you have time to stick around and listen to the answers to the questions, great. If not, we understand when you exit out of the Zoom meeting, there will be a link to complete a short survey on today's presentation, so we encourage you to do that. Question in the chat is really around Medicare reimbursement. So whether or not the 5-unit limit in the clinic setting applies. And on that same note, can you speak to whether that also applies to somebody attending an appointment with someone for Medicaid reimbursement?
Sure. So the 5 units or 2.5 hours of in-clinic time is really just for a community health worker who's working with a Medicaid recipient to begin building a trusted relationship to then transition out of the walls of the clinic into the home or community setting. If a community health worker is attending an appointment with a Medicaid recipient, that does not count against that 5 units or 2.5 hours. So it's really just building an initial trusted relationship, maybe meeting a patient or client for the first time in a clinic setting so that they can know who you are, meet with you and feel more comfortable when you do show up at their doorstep wanting to enter into their home and work with them further. You're not a complete stranger who's just knocking on their door without ever, making that connection before. When it comes to Medicare, there are no limitations with Medicare as far as where services take place. Medicare does recognize that services can take place in a variety of settings, and Medicare also does reimburse for telehealth services as well. So the Medicaid reimbursement piece is really what has the 5-unit in-clinic setting requirement. Medicare does not have any caps on the number of units that can be provided in the clinic setting.
Thank you for that clarification, Ben. Well, we are at our time for today's session. I just want to again thank Ben so much for his time today and sharing everything. I will share the PowerPoint and a recording on the SDFMC website. I imagine it will probably go somewhere on the CHW SD website as well. I'll send out an email to everyone when that happens so you get the link and can review that at that time. We encourage you again to join our session next week with Dr. Christine Arnold. She'll talk more about how they integrated CHWs into their clinical practice in Mitchell. And so we encourage you to sign up for that if you haven't already. Have a great rest of your day and a great week. Thanks, everyone.